Hello and welcome to the Gateshead Health Cancer Patient Podcasts. I'm here today at the AK Live Studios in Gateshead, and today we're going to be talking about prehabilitation, and I've got the lovely Dawn here, who's going to tell us about the new role that she has. I've known Dawn for many years as a physiotherapist. You started, how many moons ago was that?
It's about 19 years when I started in Gateshead. So quite a long time. So I've built up quite a big network of colleagues within the trust that's been able to support us with this project.
Brilliant. I suppose it's the experience that you say. You've previously done rotations and things like that.
Yeah, I've worked across many areas within the trust, but my interest is in palliative care and oncology,
Right.
and I think that's, this has been the next step from clinical work into service development within the trust.
So it was the Cancer Alliance that's been sponsoring some of this work as well. It's something I think the trust in itself has been interesting for a little while, but it's great that we've had this investment and obviously you coming on board. So can you just tell a little bit more about why Prehab is so important, especially in cancer care?
Okay, so the concept of prehabilitation has been around a little while, but mainly in non-cancer patients. So a lot of people have heard about what rehabilitation is. So that's, your recovery after an event, whether it be surgery or an accident. But prehabilitation is the process before you have treatment. So the benefits of prehabilitation, it's actually about preparing people for what's going to come next in their cancer journey, whether it be radiotherapy, chemotherapy or surgery. And the evidence is grown as to the benefits. Yeah. So some of the evidence suggests that it speeds up patients' recovery, reduces the length of stay people stay in hospital, can prevent complications after surgery as well, but also prehabilitation promotes healthy behaviours and the long-term benefits for patients after, sort of beyond the cancer journey as well, are all very beneficial.
Yeah, because I think we often talk about cancer being a very much teachable moment when it comes to patients. That their life is suddenly on the forefront of their mind, and then you've got people like yourself who come in with the information to say that your recovery and overall survival, that prehab can influence as well. There's a lot of research about that.
Yeah, there is, and I think it is that teachable moment and giving people permission to say that it's okay. They get that terrible diagnosis, and the families will wrap their arms around the loved ones, which is normal because they want to protect them. But we want people to continue the activities, the things that are important to them, because that's going to help them with the treatment. So we don't want people taken to the beds. We want them to keep on enjoying their life.
Yeah.
That it's not just about physical activity. There's three main areas of prehabilitation. So one's activity, and that doesn't have to be going to the gym or running a marathon. It's about going for a walk, doing
movement,
things.
Isn't it?
Movement
Yeah,
is about movement. Going up and down stairs is an activity. So we want you to be moving and not sitting around. Want you to be doing some things to keep yourself strong and fit for what's to come next. So the other part of that is having a healthy diet. Patients with cancer might have problems with eating, might have lost their appetite. So prehabilitation can support those patients to help with that, because we want you to have a good diet and be strong, which will enable you to then do your physical activities. And those things also impact on your psychological well-being. So for me, I see the three areas of prehabilitation working together to support one another, really it is.
And they're all kind of interlinked, aren't they?
Yeah,
You can't
they
do
are.
one without the other.
You can't.
Yeah, and
No.
it's like when you exercise, the release of those chemicals, the serotonin, and I think we could always admit that you never go out for a walk and come back and feel down, do you?
No,
There's always that feeling lifted, isn't there?
And it's a bit of a distraction as well. If you're doing an activity, it takes your thoughts away from
what it is
as well. Yeah.
And I suppose it's a sense of control, isn't it? It's something,
it is.
We tell you need chemo, we tell you need surgery, and it's like, right, well, you can dose yourself on this level of activity almost.
And it's the patient's choice. We're guiding you, we're giving you the tools. There's lots of tools out there. Macmillan have lots of information on their websites about physical activity, a healthy diet, and your mental well-being, so that it's for us to signpost and give you some control with how you prepare for the next stages. But also, once you start those, we're hoping that that continues through your treatment, but also be like throughout your cancer journey as well.
I suppose it always comes down, I always think of prehabilitation, it's like someone's telling you you're going to run a marathon, you've had a cancer diagnosis, you wouldn't give that advice or that training after the marathon. You do it beforehand. And I suppose that's what you're doing. You're giving them that preparation so that they have got that work capacity to get them through those treatments.
Yeah, definitely. I mean, the government's guidelines as well is for physical activity. I know I'm talking a lot about physical activity, but that's my sort of movement. That's sort of like my speciality. Government guidelines suggest that people should be doing at least 150 minutes of moderate exercise a week, with a strength element to that. Now, obviously, people that don't have a cancer diagnosis probably don't do that much exercise. So what we want you to do is set small achievable goals and start off with, maybe a little bit of 5-10 minutes of a walk one day, and gradually increase that. We're not expecting you to run a marathon straight away. It's about building up that activity. But sometimes we only have a small window of opportunity. You should be given this information, and that's generally will be you will be told about prehabilitation by one of your cancer nurse specialists, or it may be a physiotherapist. And there's sort of three sort of areas of prehabilitation. So you've got universal information, which is information that can be given to any patient who's diagnosed, and that maybe about continuing your activities, continue what you're doing, signposting people to websites. But then you've got patients who might need that extra support, who have long-term conditions, might have lung or heart problems, and they may need more support from a specialist, dietitian or physiotherapist. And then you've got patients who maybe are less mobile, might be housebound. They might need more support on a one-to-one basis, so that there is different levels of the intervention that can be provided, and that will be determined by your cancer nurse specialist, and you will be referred on if need be.
I suppose different cancers have got different lengths of time. I think you've already mentioned this, different lengths of time before that actual treatment starts. So I specialise in breast cancer, and a lot of our patients go off within a couple of weeks if surgery is the first line of treatment. So there's not that much, but I would still, when a woman's diagnosed, there's still an opportunity.
Definitely, evidence suggests that you can still see some improvement within 2 weeks. Ideally, we'll want more time, but patients need that treatment as well. So I think, if you can, just trying to think about that. And I know patients are getting lots of information, they've got lots of things to think about when they get that diagnosis, and I think the treatment's probably the first thing they want to have. But this is part of their treatment, really. It's getting them fit for whatever happens next.
Because it's quite a lot of this surgery that's going to happen maybe within 2 weeks or 4 weeks, or even a little bit longer. That's going to have an effect on your heart. It's going to have an effect on your lungs. And there's things like healing. When we know that people, the fitter they are, the better the immune system they have. We know that people who aren't fit or smokers, or their nutrition isn't as good, might have more complications with their wounds, which then stops things like radiotherapy, things like that happening.
Yeah, definitely. I mean, so as we went back, if we go back to before and saying that it's a teachable moment, it is about those other behaviours, about reducing your alcohol and stop smoking as well, and hopefully those behaviours as well. It's the family might take on those important information as well. So
the smoking bit, we at Gateshead Health have got support with that.
Yeah.
So how do patients access that kind of support at Gateshead Health with regards to smoking cessation?
So there's lots of different ways in Gateshead. I mean, they can refer themselves, GP practices, I know pharmacies.
Pharmacies is a really good and sometimes underused facility.
Access to smoking cessation. I believe in Gateshead that if patients are admitted to hospital, they'll be seen by a smoking cessation advisor and offered support within the hospital or given or signposted, because sometimes you've got to, for behaviour to change, you've got to be ready. So sometimes it's just having that information and then having time to think about that and then take action as need be.
Because it's hard, I suppose, because we use alcohol, food, smoking is a bit of a crutch when you're going through a life-changing experience, and I think you've got to be sensible with those expectations as well. And I think what the message I'm feeling from you is anything is better than, I suppose, nothing.
Exactly. Doing something is better than nothing, and that would be, one of the main messages that I would tell everybody. It's not about that, like running a marathon. It's just getting up and doing something.
And I suppose making that move towards that, and it's sometimes it's the habit, isn't it? If we
or reducing the alcohol or reducing the the cigarettes. So we really want you to try and stop smoking. That's what we would like. But
and I think that one of the problems is that I find is that things like social media and the fitness industry, it's got so complicated now. It's got so complicated that people are practically paralysed in choice of what to do. And again, it kind of comes back to that historic, you are a patient and, to just sort of wrap you up in cotton wool and, and just get you through and then we'll look after you at the end. It's kind of taking a different mode of care, isn't it?
It's giving people choice as well, and we use the word empowering, but it is about signposting and letting people make their own decisions. We can give you the tools, but it's up to people at the end of the day to do that.
Now you're focusing on two particular cancer groups when you're carrying out this project. Do you want to tell us a little bit about that work you've been doing?
So the project that I've been doing sort of it's had a couple of elements. So one of the things that we've been doing is providing developing a leaflet and information for the Trust website. So that would be like a universal information that people can access. And then we've also setting up a group program, which we're still waiting for patient referrals, but in some ways that's a good thing because we don't want people to have cancer, but there's going to be access to a group program. So we may offer patients a group circuit program, and then they'll attend that leading up to either surgery or chemotherapy. And there'll also be an educational element as part of that program as well, which we've got a little bit on fatigue management, preparing for hospital, a little bit about pain, and a bit about our motivation as well. So that's been a little bit slow to get off the ground because of the two areas that I've chosen.
Which is that?
There's gynae-oncology and colorectal. So we are the regional centre for gynae-oncology, so some of the referrals I have received are out of area, so I don't exclude those. I talk to those patients, whether it be on the telephone or one-to-one in clinic, and I give them that universal information and support. And because this prehabilitation is new, there's not the prehab services in some of the region as well. So there is a good prehab service in Durham, which I'm building links with, and I'm now trying to build links with Carlisle and South Tyneside and Sunderland. So
I suppose there's lots of community elements as well. Our work is a cancer rehabilitation. That's my background as well, and there's a lot of the fitness instructors now who are kind of trained up to that level as well, so hopefully the community side of things will improve.
So I'm hoping that's something, because patients want to have their sort of treatment nearer to home, they want to have the prehab nearer to home, so we're trying to have a look and see who are trained at that level in cancer specific, and that's something I've been in discussion with Gateshead Leisure Centre, but obviously they're going under some changes at the moment as well.
And I think that's going to be one of the barriers that we're facing because of cost of living and services being cut. Unfortunately, that is something else that in the community the resources are being cut bit by bit. But I suppose roles like yourself, it's about that signposting element as well. And like I say, it's so complicated. Fitness has got, we think of the word exercise and we think of the word gyms and put them together,
and you have to have that specialist knowledge, because not all cancer patients will be appropriate to say, go down to the leisure centre, go to the gym, because they might have problems with the bones that would limit what they can do. So, and for some people that wouldn't be the most appropriate place for them to go to. So
I suppose for those patients, would we then go down the next level and you kind of go to that universal level where it's...
So they would be more if patients have got disease in the bones, they would be more the specialists. So they would be needing a physio or a level 4 cancer trained fitness instructor to give that support and guidance.
But until it got to that point, you could still use those elements.
You could still have the universal
things, and I think the movement.
The movement walking is actually probably the best thing anybody can do, and you can increase the intensity with walking and power walk, and to get
you can set your own dose, can't you? Depending on what your background is and things.
And there's lots of apps and trackers. There's one called Active 10, which I've been trying to promote with my patients. It's an NHS app, really easy to use. I've downloaded it on my phone, and if you do sort of a moderate walk every day for 10 minutes, then you get little goals. You can set goals and you get a little medal or reward on your phone when you've achieved that, and I think that's a good way of tracking what you're actually doing as well. But we've got to understand as well, that prehab goes into your treatment and your rehab, and some of these patients are having chemotherapy, and what I want to say as well, for people not to be disheartened if they can't do that through the chemotherapy. Would still encourage people to do as much as they can on the good days, because it's really important when they're having that treatment, will keep you strong, because after chemo those patients may go on to have surgery. So then you're getting a bit of a double whammy of deconditioning if you don't do these activities and keep yourself a healthy diet and keep
We've just
moving.
been talking, we've had an earlier podcast with the Northumbria team, and they were talking about that they're putting a clinical trial in at the minute where they're looking at reducing things like peripheral neuropathy the day before the chemotherapy, which is generally when patients feel at their best. And I kind of we talk about dose given a dose of exercise, and there's some days where you just want a small dose because you're not feeling 100%, but those days where you're coming to your next cycle of chemo and you're feeling a bit stronger, you can increase that dose, or you split the dose. You have a dose in the morning and dose at the night. Is that something, the Prehab's really pushing?
Yeah, and I think keeping a diary can help you to keep track of that as well. And even patients who have fatigue, the evidence is still there to suggest that yes, you're fatigued and you're tired, but some exercise can help with that. So yeah, I would definitely encourage people to keep a diary, keep a track of when they're feeling good, and then maybe do a little bit more on those days, and on the days when they're not feeling so good, do less but still do a little something.
I've read some really good research about journaling as well, that it's really good for helping obtain goals. You're apparently 40% more likely to stick to that goal if you've written it down and you work out a way of how you're going to meet that, whether that's every day I'm going to do that 5-minute walk, or and again, it's those just steps towards the end of completing treatment and getting back to some degree of normal life, whatever normal is. So I think it's great preparation, and I'm really pleased that Gateshead Health is putting investment in, and roles like yourself as well. And I know the role is,
it's only for a year, so it ends in June. So we'll just have to watch this space and see, are we lucky to get some more fund, and that would be my wish, because we're only targeting 2 tumour sites in Gateshead, and
so much,
it should be for everybody. Yes, we've got that universal information we're going to have for everybody, but we would like that one-to-one support, that extra something that we can give to other patients.
Take it to the next level.
Yeah, take the next level. We talked about goal setting, and that's really important, because it's not our goals, it's the patient's goals. And I've recently worked with somebody on a one-to-one basis, and her goal was to be able to get out and about, but because of a symptom from a cancer, she struggled because of her breathing. So we talked about things, and she wanted a mobility aid, and I said, well, I think I can't provide what you're asking for, but I can provide you with a 4-wheeled walker. I said that means you can still remain mobile, and you can have a little sit down, if you need to, get your breath back. She's been out and about, she's been to different places with her family, and just that one little thing's enabled that lady to achieve some goals, and it's kept her on her feet as well.
That's fabulous. I think as well, in Prehab isn't, it's for all ages, it's for all folks. This, we shouldn't be making any sort of assumptions that somebody couldn't achieve that. I mean, I've had a lady in her late 80s who's been diagnosed with breast cancer, and she's waiting for her surgery, and she's relatively fit. And I asked her about what did she do, and she doesn't like to go far, she's worried about falls, and she's lost her confidence, especially through COVID. And I said, Mary, if you can just get to the bottom of the path, and every day just see how many times you can travel to that bottom of that path over the next couple of weeks, that's great. And she managed to do that, and then she's ended up leaving that gate and getting to the next lamppost. And it's her confidence, isn't it? It's that's
it is.
And I think that's what the beauty of your role is going to be.
Yeah, definitely, and giving them that little bit of guidance, and then they think, oh well, I've achieved that, maybe I can do a little bit further. For things that they didn't think they could do, or things were stopped. That was this lady's breathing was stopping her doing those things. I
suppose it's the small things. We small molehills to get you to those larger mountains, and it's the little work, and that's not going to happen overnight. But I suppose the support and the information that's being generated through Gateshead Health with all of that is going to help, and I really hope you're all the best and
thank
success.
you.
You've honestly, the website and the leaflets are doing such a great job. So fingers crossed.
I hope so.
Yeah, but you've been absolutely marvellous today.
Thank you.
Like I say, we've got the website, and hopefully patients can get some more information from that. Just remind us about the website.
So it's just on the Trust external website, Gateshead Health, and the information for prehabilitation, is under cancer services. It's still work in development. There's a little bit of information on there, and there will be more things going on there in due course.
Oh, that's fabulous. Oh, well, all the luck.
Thank you.
And thank you so much for coming today. It's been great. Thank you.
Oh, thanks, Chloe.